1 year old by myself. My family is back in Korea, and eventually I went into surgery for mastectomy all by myself. I didn't want anyone to come with me. The official diagnosis was in June 2016, but a year before that, my gynecologist said that, oh, women over 40, it's just you just go do your mammogram. I have never done it. So I went to do my mammogram, and okay, there's something, calcification, a little dense, and come back in 6 months. And so I did come back, and they said, nothing changed, still it's very dense, and we want you to do a biopsy to make sure that whether it's not cancerous or not. In May, the biopsy finally showed that I had a DCIS, which is called ductal carcinoma in situ, which is not invasive, but it's a cancer. That was on my right breast. The standard treatment was to have lumpectomy, which is just taking just that part out and you keep your breast. But then the follow-up treatments were going to be radiation therapy and then to be on the medication, which is called tamoxifen. That was sort of suggested standard treatment. Another way I could opt for was to have just mastectomy, which is to just remove my entire breast, affected breast. It was the hardest decision I had to make in my life. Terrified, frustrating, and stressful. Stressful because none of these treatments was perfect. I decided to have unilateral mastectomy was because I didn't want to do radiation therapy, which I should have had I decided to do just lumpectomy. And I was so afraid. Just going for another treatment, one after another, was just exhausting. So I did not. For me, the first biopsy, because I had never had any sickness or major illnesses before, so I didn't even know what biopsy was and how biopsy for breast was going to be done, and I didn't know what this would lead to medically, and I was just terrified, and I was alone. Taking breast biopsy is really, really difficult. Like, you have to position in a certain way for like an hour or two sometimes. And that was tiring, but also I felt so alone. So I remember after the biopsy was done and you had to stay in bed for a while, and I remember crying. The nurses didn't know what was going on, maybe just because, oh, she might be afraid of having cancer, but I think it was more than just the having the cancer, but it was everything that just kind of was culminated emotionally. The depressive feelings, right, after you were diagnosed is, I think, it's tremendous. And of course, it could vary from one woman to another. But I don't want to talk about this notion of depression clinically, right? Because it's not that you have some clinical history. It's normal. It's a normal reaction emotionally and psychologically. So it's great also help to speak to professionals, and of course not to mention your own family and friends. But if you don't feel comfortable finding a wonderful therapist like I did, it's also wonderful. Ultimately, the decision was all made by myself alone. Of course, I did talk to a few friends, right? What if you were me, what would you do? But they're not going to tell you. So they gave me some feedback and perspectives. It was very helpful, but ultimately, the decision had to come from me. So I did the decisions on my own. I so wanted my nipple to stay there as part of my body. I was lucky enough that I could salvage my nipple. And I was so naive that okay, then everything is just, the tissues would be gone and everything would be, my nipple would be just, normal and everything. So the idea was very, very nice. So, but then the reality was not the same, right? I had some side effect just right after the mastectomy because there's no blood circulation, right? So it was dark and I was terrified by the the look of this side of surgery at first, it was like a traumatic moment. And I remember calling it to shoot, just hysterically, to shoot, my nipple's gone. Don't worry, it'll come back. But it's not the same, but at least it's there. It's different form, different color, but it's there. At least I have something. Essentially, I would say no. I don't think that the treatment and the surgery have changed who I am. However, on a daily basis, I think it does affect me, affect how I feel about me, about my body. I would not say that this everyday self-gaze or struggle would change ultimately who I am, but it does have some effect on my own gaze and my own body. So it's still the process of coming to terms with this. I used to look at myself in the mirror more obsessively every 5 minutes or 10 minutes. Now I do look at myself in the mirror a little less. I do. I wish I didn't have to. So much. As far as treatment goes, post-surgery life goes, I feel okay. There's a little bit of denial, there's a little bit of disavowal, forgetfulness, which I think is helpful sometimes, but there's still this permanent awareness of my own body that is different now. I'm doing okay. Intellectually, I don't think that this whole medical experience has changed my identity or subjectivity as a woman or affects any negatively my own sense of femininity. However, I love clothing, I love fashion, I love beauty, right? For certain clothings that I used to like and I didn't like because of my asymmetrical contoured and shape and structure. In those moments, I'm reminded of my medical treatments and the loss of part of my body, the organ. In those moments, I feel my femininity has to be readjusted. It can't be normative, right? Way of femininity. So maybe there's a different way to look at it. I do feel sexy, and of course, feeling sexy is subjective. I do feel sexy just when I feel like myself. So I would hope to feel sexy as longer as I could. I would suggest or recommend women who have just been diagnosed. The first thing, start looking up internet, the forums, all these stories, right? Which treatments or surgeries are better, and all kinds of negative experiences these women have. It's their health. Don't be alone. I would like to tell these women when they first heard of their diagnosis, don't isolate yourself from families, your family and your friends. Talk to them. Let them know how you feel. And let them know your difficulties that you're having. Anything, right? Ask for help. I wasn't exactly doing that myself, and I don't regret, of course, but I think eventually I just learned that they're amazing friends, and then of course your family will be always there. They are there to give you support and encouragement and give you love, and I think that's an amazing gift. I decided to participate in this amazing project. First, because I like you, Tula. And it's very true. You really helped me. You really came over to my apartment that summer when I was diagnosed, right? With this books on cancer, and showed me your own breast and let me touch your breast. And that was really an incredibly meaningful moment for me. our female bond is very important, and we had known each other before then, but just as a colleague. So that there's a personal meaning to it. But now outside of the personal meaning, this is also, it's a little bit of personal and the non-personal, that I wanted to see how I am going to deal with this difficult experience of exposing myself to the public, or exposing my very private life, private body to the public. So I wanted to see myself going through it. So to all these women in Syracuse, be inspired and have some different ideas about what